Off to hospital we go for precautionary check.
Get around the other way.
Just round to your right.
Well, no, I don't have a real test at this stage, but I'll get the next out for you.
3 AM on Australia Day 2021, I was awoken by what was episode 8 since New Year's Eve. Obviously a mental issue or drug induced, I'd say. First food in 2 days. Curried egg sandwiches, one of my favourite. Well, not the best way to spend the day in emergency. Anyway, turns out pretty good. The wasn't a heart attack, so gallbladder, gallstones, whatever. We'll see how we go. Well, you know how often I say that things just come up and I don't always get to make a video that I planned. Well, this is one of those moments. Here in the hospital, decided to finally call them on doctor's recommendations, and I always knew it would be ultimately what happens. Just sitting outside for a few minutes here because phone reception is 0. Yeah, so essentially in a nutshell, my troponin levels from the blood test proved it wasn't a heart attack, so it's my gallbladder, which means by 3 surgeons that have spoken to me that I should get that removed, and hopefully it will be in the morning. I'm spending the night here, as you can probably see behind me, and yeah, hopefully in the morning, otherwise it'll be the day after. Then I have to stay 1 night extra for observation. So they all assure me that it has nothing to do with your immune system, which I've heard some people say they often get sick after it. But anyway, I certainly don't want to live with the pain, because it's been 10 out of 10, and it came on 3 o'clock on Australia Day. It woke me up 3 o'clock in the morning. So there we have it. Such is life. It is what it is, as I say. So yeah, anyway, that's the update. Thought I'd throw together this video with a bit of footage that Laddie took at my request of me getting into the ambulance this morning. It's been a long day. If I sound a bit slurred, it's because I'm that doped up with, like, I don't know, 6 maybe or 7 shots of fentanyl, not V but F, fentanyl, which is a synthetic morphine, and even that only dropped the pain level by about 1, and some other things too. It's actually the first time in nearly 3 days it's actually reasonable now, the pain level. So I'm about to go upstairs to the ward and try and get some sleep. So I think I'll be able to do that. So I thought I'd throw this video together about going to the hospital. Not my favourite thing to do. I don't mind when I'm working here as a simulated patient, because I get to go home at the end of the shift and I actually get paid for it. So anyway, yep, just one of those videos that have come along, and well, here's a cannula in my hand. So yeah, get it over and done with, get the gallbladder removed, and because the pain It hasn't stopped this time. I've been getting it since, well, all my adult life, but it used to be like once or twice a year, and now it's this is the 8th episode since New Year's Eve that I spent in a very hot bath trying to relieve the pain. So obviously we've gone as far as we can with it, and that's that. Ultrasound showed my gallbladder was a complete mess. The largest stone of a few was 1.5 centimeters in diameter, so that's like an inch. Pretty big. Gallbladder's not that big, so yeah, and it's very inflamed, which is why they've given me well, not anti-inflammatories, antibiotics, and another round in the morning. So hopefully, since it's marked as urgent, we'll get that over and done with. So I'm not sure how much a gallbladder weighs, but this is one way of losing weight, I guess. Always look on the bright side of life. Huh. Reminds me of a song. And thanks also to people that have followed the posts about this in my community tab. It's very much appreciated. Yeah, I can't really say I hope you enjoyed this video, but that's what I sometimes do. I just record life events. Not all of them, but sometimes. So there we have it. So cheers everyone. Sorry about the lighting and everything, but yep, there we go. So hopefully back to normal scheduling soon. Well, can't be soon enough for me, that's for sure. Alright, cheers, and speak to you soon. Bye. Please note I deliberately didn't record much inside the hospital this time, primarily for people's privacy, and you did see 18 months prior a little bit of me recording in the hospital, so that's the reason why there's not much inside footage. And that's what it's like here at close to midnight. Time to go to bed. Well, it was 7 hours from when I went today for the gallbladder removal to when I get back to the ward. Anyway, I should look lighter now because I'm now missing a gallbladder. It's very bruised in the area they took it out. It was keyhole surgery, and all apparently went well. So there you have it. There's a gallbladder operation for you. Alright, hopefully going home tomorrow. Should be. I will be, regardless if they want me to or not. See ya. I'm going off to bed now. Right, well, for I've actually got another video like this too, where I'm now leaving the hospital, and thanks to Letty for picking me up, and yeah, all good. Going home, so that's the end of that. Thank goodness it wasn't my heart. Anyway, so I'm now massively lighter, as you can notice, because my gallbladder is no longer with me. Yeah, I think they weigh only a few grams, but anyway, it all helps, doesn't it? Alright, cheers, thanks for tuning in, and yep, as I said, a spontaneous video often happens. Bye for now. Well, thanks for staying on a few seconds later after what was going to be the ending. Just letting you know, it's now 24 hours since I've come home. All is going pretty well. I obviously have aches and pains in the belly, not too bad. They're getting better, because the recovery obviously will be a bit slow from healing of the operation inside, etc. So yeah, it could be 2 weeks. I'm not allowed to drive for at least 1 week. So yeah, not allowed to lift anything over 3 kilograms, which I don't know how I'm going to get it to the toilet. But anyway, I'll soldier on. I'm taking it easy. I updated while I was in hospital the community tab, if you want to go and look back through that. I couldn't update everything for some reason, and I'll tell you one thing, they pumped me full of so much morphine and endone. Seriously, I was battling trying to type anything. It was just nonsensical, or I'd doze off and have just deleted everything I wrote. Yeah, quite trippy. It didn't ease the pain much, but certainly, yeah, sent me out there into the life of the pixies. So thanks everyone that gave their regards. It's definitely worth noting that my loyal Teddy the vlogging cat, that's you, stayed with me from the moment I woke up at 3 AM Australia Day, even following me to the hot bath, and stayed nursing myself until I went off to hospital in the ambulance, and even since has been watching my recovery by building herself a little cubby or den inside the walk-in wardrobe. So thank you, Teddy, for your loyalty, as always. Yeah. Animals sure do know, don't you? No, do she said. I did a video, the Holder Clark liver cleanse diet, a few years ago that may have staved off things, I don't know. But feel free to watch that as well. I'll put it up here somewhere. And yeah, so that's it. No more gallbladder. And so hopefully no more of those pains. At least it wasn't a heart attack, which it was likely, or semi-likely, that it was, given the similar feelings. Although I didn't think it was, I always thought it was gallbladder or gallstone related. So at least that's taken care of. So I'll continue to put up videos, yeah, I hope you'll enjoy the next one after this that I shot just the day before with a friend of mine, and it's a different pace again. So thanks everyone for your ongoing support. I really appreciate it, and I'll see you soon. Cheers for now.